Yesterday, the province's COVID-19 science advisory table said about 53% now of all COVID-19 cases in the province are caused by Omicron. I'm joined by Dr. Christopher Labos, epidemiologist and cardiologist. Dr. Labos, these numbers aren't good.
No, they're clearly not. Things are clearly trending in the wrong direction, and we're going to have to do something if we want to reverse that trend. We know what the solution to this problem is. We simply need the political and the personal will to make it happen. And the answer is we need to limit person-to-person contact. The more we can limit person-to-person contact, the less opportunities the virus has to spread from person to person. So we need to roll out vaccines and boosters. That's obviously the long-term solution, but the short-term solution is capacity limits, getting people to work from home and limiting the number of times when people come face-to-face with each other. And unfortunately, some of that is going to include keeping holiday gatherings on the smaller side.
Doctor, the RT number is 4.55 for Omicron, though, and as we see these numbers spike, each person represents one person who can potentially infect four others. That's exponential math. Is there doubt in your mind that eventually it will reach almost everybody, vaccinated or not?
Well, so a lot of this, so here's the thing, the RT number depends not just on the virus, but it also depends on us. The actions that we take can change that. So if we shut things down, if we work from home, if we don't go out to large parties, if we don't have restaurants at full capacity, the RT number will fall. So our actions can influence all of this. So we can contain the virus, we can limit the spread. It's simply a question of, are we prepared to do the things that we know work? And while I understand the reluctance that some people have to go back to some of the COVID measures that we've had in the past, it is necessary, because if we do nothing, eventually it will spread unchecked.
You talk about political will, though, and the politicians say, and it varies from province to province, that's why it's also difficult to kind of, digest, but they say they are doing what they can, but there's also a limit to what people are willing to do. I mean, Jason Kenney's an example of that. He's raising, the rules for capacity, including those who are unvaccinated, because he says that people aren't going to follow the rules. So to protect the integrity of the rules, we have to, give people some leeway. It seems like a disconnect, but people are buying into it.
Yeah, I mean, all I can say is it's a good thing the government doesn't take that approach to bank robberies. Otherwise, we'd be letting people rob banks with no consequences. There are consequences to these actions. The situation is worsening. If we loosen things up and allow larger gatherings that include unvaccinated people, there will be more cases. I mean, Alberta saw the consequences of these actions over the summer, where they opened everything up and then the Delta variant hit and they had a disastrous fourth wave. Well, history is in the process of repeating itself. When things get bad, the correct course of action is to limit group activities, to limit the spread of the virus. If you don't do that, then cases shoot out of control, the hospital system becomes overwhelmed, and you have to shut things down anyway. So you don't really gain anything by waiting. You just make it so that the intervention you ultimately have to employ is more severe than the one that you would have used had you acted earlier.
So, Dr. Labos, I just want to be clear. Are you saying we need to go back into lockdown, because ultimately that's where we're going to end up?
I don't know if we have to go back into a full lockdown, but we have to do something to curtail the spread of the virus. And we have to realize that not every business carries the same degree of risk. When you're talking about most retail stores where you go in, buy one object, and then come out again, if everybody's fully masked and there's good ventilation and everybody's vaccinated, the risk is probably pretty low. But there are certain situations, like where you're serving food and drinks where people are unmasked, that are by their very nature higher risk activities. So we can't paint everything with the same brush. But we have to realize that if we're going to have full capacity in venues where people are by their very nature unmasked because you're serving food and drink, that is a high risk activity, and probably not something we want to be doing when we have, a highly infectious variant circulating that's looking to become the dominant strain in this country.
Dr. Christopher Labos, epidemiologist and cardiologist, thank you for your time, as always.
My pleasure. Take care.